The INLP is the Integrated Nurse Leadership Program, which is a grant funded by the Moore Foundation given to UCSF's Center for Health Professions. One aspect of the grant is to take a cohort of hospitals and teach them skills, tools, and resources to improve sepsis so that sepsis patients can have a positive outcome as they move through our hospitals.
For me, one thing with my involvement in INLP has been really learning how to collaborate with nurses who have some really fantastic ideas, because they're really in the trenches, they're at the bedside with the patients, they're the ones who are really spending the most time at the patient's bedside of pretty much anyone in the hospital, and they have some fantastic ideas on how to improve care for patients. Particularly with the sepsis project, they've really grabbed on to improving the care of the septic patient as something that they wanted to change at our hospital, and using their energy and ideas through talking with me as the medical director in the emergency department, they've really helped me learn how to work with our administration and the physicians in the hospital who aren't necessarily involved in day-to-day operations in the ICU or in the emergency department.
The biggest benefit from this program, I think, is that you actually take away knowledge that you apply and you retain. It's that retention that I think is one of the best things about INLP.
The other thing that I really came to appreciate, and through some of the sessions that INLP hosted during the development of this collaboration, was how some of the non-measurable, non-tangible things are in human behavior are so important to change. I've worked on a lot of initiatives in our organization and hospital, and I feel like this was the first one where I really felt like there was a level of success that came out of being able to truly collaborate with the other colleagues in the hospital.
The biggest value that INLP brought to our organization was obviously the saving of lives of our patients and the improved patient outcomes for those patients with sepsis. That was clearly the best outcome we could have possibly hoped for.
INLP has made a terrific difference in our organization. We've been able to come together as a multidisciplinary team, both physicians and nurses, to address the issue of sepsis in our workplace.
Remember how frustrated you are when you know that there's a better way to do something and nobody will listen to you? The INLP will give you a voice. It will enable you to take your wonderful idea, learn all the skills you need to influence people who are perhaps higher on the food chain than you are, and let you get that to work. That's my biggest pitch, and I think you see it with the nurses who've participated in the INLP. They suddenly feel powerful and able to influence the work that they do, and it's wonderful.